Hello and welcome to our Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And today I have a guest with me, and my guest today is Dr. Sharon Vallone. Welcome, Sharon.
Thank you so much.
It is so good to have you here. And we are, I'm always so glad that we're doing this, that we get a chance to talk to our speakers here that are speaking for us at Gold and learning a little bit more about them. So thank you for your time here with me today.
I appreciate being here, Kristen. It's a wonderful audience to be talking to.
And I am very excited about the topic you will be presenting for us at the Gold Learning Online Tongue-Tie Symposium of 2019. I'm so glad you're part of this. But before we go into that and talk about the symposium and talk about your topic, tell us and our listeners a little bit, where in the world are you located, Sharon?
I'm located in Connecticut on the east coast of the United States.
That is wonderful. So you are, we just had recently a hurricane here down, but you are safe up there where you are, correct?
Gratefully, we are. I have a lot of family that were down in the hurricane and had to be evacuated. So fortunately, they're all safe, and we're really praying for all the folks that are going to go through this storm.
Absolutely. Oh, good to know. So, Sharon, tell us also a little bit about your background. I see here you are a chiropractor, right? You have also a degree in microbiology. So tell us a little bit about your journey and how you came to where you are now.
Well, a convoluted story, but the work in microbiology, although interesting, I knew I didn't want to stay in a laboratory talking to organisms that lived in a petri dish. So when I was a young mom, I had to take my son, well, didn't have to, but was suggested I take my very young son to a chiropractor before having him go through surgery for hip dysplasia. And again, the medical doctors called it a miracle, but I now understand the anatomy and physiology involved. He did not need to go through the surgery, so my interest was piqued, and I began to really learn a lot more about the musculoskeletal system and the nervous system, and decided to go back to school for chiropractic. As a young mom, when I was going through school, when we had to do our clinic work and, gather patients, you had to see a certain number of patients before you could graduate. All my patients were coming from a population that was more pediatric than adult, because what was I doing? I was doing Girl Scouts, Boy Scouts, soccer, baseball, PTO. So I was working with families, and I was working with the children who were friends with my children. And having breastfed my children, having had some problems when I breastfed my daughter, but not understanding those problems at the time, I began to work with a lot of breastfeeding dyads as early as my clinic time in school. As the years passed, I had the great good fortune of meeting wonderful IBCLCs who would come to my office with their patients so that we could learn together, how best to help these moms. And for many years, we had a good measure of success, but there were still those moms that I felt we'd failed. And in 2005, I met Dr. Betty Carullos and Kathy Watson-Jenna, introduced to them by one of the IBCLCs in our state, Jennifer Tao. And Betty and Kathy came and spoke to a large group of us in Connecticut, educating us about the never before heard of posterior tongue tie. And it's been an adventure since then, meeting so many people in the field, so many fields that contribute and collaborate to work with these dyads. And my practice has, in the last almost, 15 years, been directed by working with children with physical, emotional, and genetic challenges, as well as women who have high-risk pregnancies, and of course breastfeeding. This is the topic. And so many children initially that I was introduced to were in advanced stages of intervention like nasogastric tubes and GI tubes, to then just realize they have posterior tongue ties. And when these were released, when the children were able to be taught how to use their oral motor structures, they breastfed successfully and have now had a normal life. And not every child is this miracle, but enough of them were seeming miracles that it has kept me very passionate about educating both chiropractors as to how to help with the biomechanical issues that are associated with posterior tongue tie, but I've had the great fortune of also teaching with other IBCLCs to help IBCLCs, dentists, medical doctors understand the role that bodywork can play on these biomechanical issues that come about because of the tongue tie.
Well, thank you, Sharon. That was wonderful that you shared that with us. First of all, sharing your personal story there about your own child and how that changed your entire career path to this journey where you are now, and your passionate work. And I can hear it in your voice, really, how passionate you are about this now, working with children and families. And I want to tell you a little bit how I was introduced to pediatric chiropractic care, because I thought it was just mind-blowing and fascinating to me. As a midwife, when I was in training, I remember this very, very well. We had a birth. It was a difficult birth. The baby came out a little asynclitic, and didn't want to nurse, and was a little bit of had a rough birth. So you could see that in the baby too. So the midwife, old seasoned midwife, she was wonderful, called out to me and said, "Call the chiropractor." And I'm thinking, yeah, I've been to the chiropractor, I've been adjusted. How is this going to work with a baby? So I was really a little bit of, how is this going to turn out? Chiropractor was wonderful, came directly to the birth center and adjusted this new baby. And it was, I was just standing there, my mouth dropped open, I can tell you this. It was so gentle and so you could see the baby relax in the hands, so just very gentle. I don't even know how to call this. It's not like an adjustment where you can say, oh, like a cracking, no, nothing like that. It was so gentle. And after that, you could really see them, almost the baby releasing. And then when it came to the breast, it was able to suck and to nurse. And for me, I was just standing there thinking, wow, this is amazing. That was a real eye opener to me. So from that day on, in my own practice, I'm the biggest fan now of chiropractic care for little ones and babies and families in general, also for pregnant women, of course. And I'm really, really learning a lot now too about, tongue tie, especially now we are here at the symposium. And I'm very, very excited that you're presenting on this topic because, tongue tie, we're learning a lot about it. But looking at your title here, the impact of tongue tie on the musculoskeletal and the nervous systems, I hadn't even thought that far. Now it makes, of course, perfect sense that there is a relationship. But tell us a little bit more and tell us a little about your presentation now.
Well, if I can take an opportunity to just say this because of what you just shared, and I appreciate that, is when I talk to large groups, I try to always emphasize that this collaborative approach is so incredibly important, and that everything isn't a tongue tie, even though that's our important topic that we're going to talk about today. But everything isn't a tongue tie, and we want to be sure that we've examined the baby from every angle before intervening with something like surgery. And as you witnessed at this birth, an asynclitic presentation can result in minor biomechanical changes that might prevent a baby from being as alert or automatically going to breast and suckling. And by the gentle correction of those biomechanical problems, we have a child who now is alert and able to suckle. So I just always like to emphasize that that's why collaborating is so important, that there isn't one answer for every single child, and every single child doesn't have a posterior tongue tie, and we want to be sure we've done our due diligence and we've ruled out everything else before jumping to that conclusion. So that's my pitch there. But my talk, my talk will be just an hour to fit a lot of information in. But what I'd like to do in that hour is really talk about how biomechanics affects the nervous system and how biomechanics and the nervous system can affect the baby's ability to suckle effectively, efficiently, or even to suckle at all. Sometimes that inability to suckle could be because there is a disconnect or pain is actually interfering with the baby's ability to organize and integrate the pieces of information that should be coming in through the sensory system so that they can organize themselves around breastfeeding and efficiently transfer milk and digest it and be happy. So I'm going to talk about the actual anatomical structure, the bony structure, which of course a chiropractor is interested in, but there's the muscular system and the fascial system, connective tissue that holds us all together, and how do these mechanical components affect the nervous system, and then what is being driven by the nervous system. For example, what systems become out of balance if a child is experiencing pain? What can that interfere with? So that's what my lecture is going to be about, and to hopefully by the end of the lecture there will be an understanding why evaluation by an individual who understands the biomechanics and the neurology of nursing, as well as potentially doing some type of manual therapy, whether that manual therapy will actually correct the problem without any other intervention, or whether that manual therapy is supportive in preparation for an intervention by reducing spasm or reducing restriction, and then plays a role in the habilitation after intervention so that any remaining imbalances due to compensations that the child depended on before can be released, and they can be shown, if I can use that word, they can be shown that this new way with released tissue, where they no longer need to compensate, and that actually they will have a much more peaceful job of doing their most important work, which is eating and breathing.
Absolutely wonderful, Sharon. I'm really looking forward to this presentation. So much information in all in 1 hour, right? So you really have to
Right.
pack all that in there. Sharon, before I let you go, and we're all looking very much forward to this presentation. You've already mentioned one thing before that was a little nugget of wisdom. That was you said examine the baby from all angles. Not everything is a tongue tie. Not everything is just one. You have to do a careful examination before jumping to any conclusions. What other nugget of wisdom does Dr. Sharon Vallone have for us?
Oh, my.
Probably many.
Really, my reason for being here,
Mhm.
it's about collaboration. That these children, these dyads,
Mhm.
deserve the best. And no one of us can be everything to the dyad. So the blessing for me has been this wonderful journey of learning how to collaborate with other practitioners and to develop mutual respect for what each of us can offer to the dyad. And, my emphasis always to my students, to my patients, to my comrades is communication. That if we don't communicate with each other, there's a chance we'll miss an important piece. And so that would be my nugget, is how do we all work on this communication?
Well, thank you so much, Dr. Sharon Vallone. That was absolutely wonderful. And I know I put you there on the spot, but I know it was worth it because I know something good would come out of that. So thank you so much for talking with me here today, Dr. Sharon Vallone.
Thank you, Kristen. It's been my pleasure, and I'm really looking forward to this presentation.
and us too here. And the presentation, The Impact of Tongue Tie on the Musculoskeletal and Nervous Systems, is part of the Gold Learning Online Tongue Tie Symposium of 2019. The presentation will be live on September 17th. So to our listeners now, when this presentation is in your time zone, and information on the other presentations in the symposium, you can find out more and by going to goldlearning.com. And I highly recommend this. We have 10 hours of education on the latest evidence-based care and information on everything related to the topic of tongue ties. So I hope to see you all there. And thank you everyone for listening. Bye-bye.